Hello and welcome to North Valley Plastic Surgery. My name is Dr. Stephen Gitt and I am a duly board certified plastic surgeon. I'm going to talk to you today a little bit about breast implants. Breast augmentation is without a doubt the number one cosmetic surgical procedure being performed today in the United States of America. In our practice, we mirror those trends. We do more breast augmentation surgeries than any other cosmetic surgical procedure, far and away. And one of the fascinating things for me over the years of doing breast augmentation surgery is that when I started out and did my first breast augments in the late 1980s, we were using vastly different implants than we are using today. The old style silicone gel breast implants were in use at that time, the so-called second generation implants. The first generation implants were those that were used in the 1960s and 70s, and they changed a bit in the 1980s with the second generation. And then when the silicone gel breast implant controversy of the early 1990s came around, and in 1992 there was a moratorium issued by the Food and Drug Administration mandating against the use of silicone gel-filled breast implants in the United States of America for a number of years. Some number of years after, I believe in about 1998 or so, silicone gel breast implants were reintroduced to the market in a very controlled fashion. Certain cases or certain patients were allowed to have silicone gel breast implants on a controlled basis. Specific cases such as replacement of old silicone implants, when we did a breast lift with a breast augmentation, or in reconstruction after cancer, and those patients were followed closely and meticulously. With these new third generation silicone gel breast implants, the scientific energy that was devoted to studying them has been extraordinary. In fact, they are probably amongst the most highly studied medical devices in use today. And the third generation of the newer silicone gel breast implants, such as the one I'm holding up here now, have been studied so exhaustively that a number of conclusions have been drawn. One study out of Calgary, Alberta, fairly conclusively showed that there's no association between silicone gel breast implants and breast cancer. It just has nothing to do with breast cancer, period. There was a large study done out of the Mayo Clinic, a very well done study that I believe was published in the early part of the new millennium, that really conclusively showed that there is no association whatsoever between silicone gel breast implants and any of the autoimmune or rheumatic diseases such as rheumatoid arthritis, lupus, Sjogren's syndrome, atypical rheumatic disease, arthritis, neurologic diseases, all of it which had been alleged to be associated with or caused by breast implants have been pretty much conclusively shown not to be the case. The bottom line, today's silicone gel breast implant is the best implant that's ever been on the market in the United States of America. They are safe, they are used on a daily basis, and in fact, well over 80% of breast augmentations that are done today, those patients are receiving silicone gel-filled breast implants. Now, this generation 2 breast implants, like the one I'm holding in my hand, had a much more liquid type of silicone gel than do the present implants, which really have silicone gel, the consistency almost like a gummy bear, the so-called cohesive gels. These older style implants they felt very nice. They're nice and soft and squishy to the touch, and they feel very much like a natural breast. The problem is, if and when one of these old style implants would rupture, the silicone gel would permeate throughout the breast because it was more liquid and could sometimes even travel to other parts of the body. Saline breast implants, the tried and true staple of our specialty, have never been withdrawn from the market in any way, shape, or form. When you hold a saline implant, it has a very different characteristic of feel and touch than a silicone implant. A silicone implant is much softer and more pleasing to the touch, much like a natural breast. A saline implant is just that. It's filled with salt water, and it has a specific endpoint where you can squeeze it to a certain degree and then it gets hard. There's also a higher tendency of saline implants to ripple, just like we see here on the edges of this implant when it's inside of a patient's body. These ripples can be visible. That's one of the main reasons that we frequently, in fact most often, will place these implants underneath the pectoralis muscle in the chest wall, because that extra layer of tissue covering the implant tends to force it to assume more of a teardrop shape, and also tends to minimize the potential for noticeable rippling of your skin overlying the breast implant, which is a very undesirable and unnatural look in the augmented breast. So, what happens when a saline breast implant leaks? Well, I'm going to show you what happens when all three of these implants leak and when they're cut. I have here an 18 gauge needle, and I'm going to simulate what happens when there's rupture. With a saline breast implant, when it ruptures inside of your body, saline will gradually and slowly leak out. That little pinhole, you can see just a small amount of saline can steadily leak out and drain into the area of the breast. And that particular drainage is easily absorbed by your body because, in fact, the human body is 65 to 70% made up of saline. So when a saline breast implant ruptures, it can be a very slow process or it can be a very fast process where all of the saline leaks out in short order. Either way, you'll notice a diminution, a decrease in the size of the breast. It'll become much softer, more ripply, and then asymmetrically smaller than the other breast. And when that happens, it's pretty obvious you've got a leaking implant. And what do we do with a leaking implant? Well, we take it out and in most cases exchange it for a new implant. Many patients will want to go to a silicone gel breast implant at that time or stick with a saline implant. The two major implant manufacturers, Mentor Corporation and Allergan, both offer very nice warranty programs with their implants so that in the event of rupture, for a specified period of time, usually about 10 years, the manufacturer will supply a new implant free of charge, and for a finite period of time, they'll put forth some money towards your secondary surgery to replace the implants. Furthermore, the removal of ruptured implants is most often covered under your health insurance policy. At North Valley Plastic Surgery, we do accept health insurance for your care whenever possible. Obviously, it's much more to your advantage to use your health insurance coverage to pay for surgery when indicated and when allowed, as opposed to spending money out of your pocket. So that was a saline breast implant. We're going to move on to the second generation, or the generation 2 silicone gel breast implant. Recall that I said a few minutes ago that this particular implant has a much more liquidy form of silicone gel. And when this implant leaks or ruptures for whatever reason, this silicone gel tends to leak into the implant pocket and may make its way into the soft tissues around the breast in some cases. So, there we go. You can see how it's very liquid, sticky, and gets all over anything and everything, and it comes out fairly easily from a small hole. This particular silicone gel gets on you, and it's hard to get it off because it's very sticky and adherent. You see how it flows much more easily than, you can see how it flows very easily, and once you have a hole, they tend to enlarge as the silicone flows through it. Now, I mentioned earlier that the third generation silicone gel breast implant is a better implant and has a much lower tendency to leak. Recall a few moments ago when I placed a hole into this second generation silicone implant, the silicone tended to ooze out and the hole tended to expand. Now when you take a third generation or a modern silicone gel breast implant and you poke a hole in it, for the most part that silicone's not going to want to come out. It may come out just a little bit and then it'll go back in for the most part when the implant relaxes. So if a patient contracts her pectoral muscle and squeezes the chest, a little bit will ooze out and then it'll want to go back in. This is cohesive gel. It's cohesive, and that means it tends to want to stay in one mass. It wants to stay together. It has a much higher degree of cross-linking of the silicone, and what cross-linking is just what I'm showing you with my fingers. The silicone molecules want to stick together. They don't want to fall apart. They're linked together to a much stronger and higher degree. So again, when this particular implant starts to leak, it's not so simple. It tends to stay in one place. Now, when I cut across this implant, typically will sit still almost like a gummy bear, which is why these implants have earned the nickname of the gummy bear implants. So let's see what happens. Silicone gel has a much lesser tendency to want to stick to anything else. It is more cohesive. See? It tends to sit within the implant as opposed to the other implant where the silicone oozed out. The first generation silicone was in fact quite liquid. If you cut it, it just all came out. This is why these implants tend to hold their position much more effectively and have a lower incidence of leakage. It's very difficult to make one of these implants ooze its silicone completely out. It just won't go. And again, these are the implants that we're placing in 80% of our cosmetic breast augmentation procedures today. If you have any further questions, email us. We'll be happy to hear from you. Or we do complimentary cosmetic surgery consultation here at North Valley Plastic Surgery with myself, Dr. Stephen Gitt, or any one of my three partners, Dr. Martin Bell, Dr. Dominic Heffel, or Dr. Ryan Sujimura. Have a good day.